healthy, improve health for those that can get better, and prevent future health issues.
Anything you get off of the street or from somebody who's not a pharmacist that's selling from the pharmacy is suspect. Anything. We're not seeing it yet in marijuana, but there are some reports in Mexico of that happening. If that were to happen here, we would see a sudden increase in spike in overdose deaths if they were spraying fentanyl on marijuana, because you're not expecting that, right? So you're not going to smoke just a tiny amount, perhaps. That's a very big concern.
And I would say that the things that I really care about in my activism is that I care about what works for people. And what works for people is you learn about what works for people from research. And so I do work with PCORI, the Patient-Centered Outcomes Research Institute. I work with CMS, the Center for Medicaid and Medicare Services, and patient, how do you build an infrastructure to develop patient-centered outcomes. I'm interested in how people make decisions, and I work with some agency for healthcare quality and research, ARC, and on patient-centered clinical decision support.
If that vote had taken place 10 years earlier or 50 years later, Grantsville would have won by a landslide. Because what happens is, over time now, the railroad is king, and everyone's going to Oakland, and a lot of travel's going into Oakland. And they have their 3 presidents that came into Oakland, although Grantsville has its 7. I'm just saying.
So part of the Robert Wood Johnson, the one thing that they stress is that no single organization or sector can change the trajectory of America's health alone. The mission of the Robert Wood Johnson Foundation is to improve the health and healthcare of all Americans. Their focus area is to explore on health leadership, health systems, healthy communities, and healthy kids and healthy weight.
$24 billion, which is still substantial. Hospitalizations that do involve sepsis, they cost 70% more than the regular hospitalization. So this is why the federal government's paying attention, because it's expensive.
Aaron, one of the reasons he wasn't actually in the walking gallery, but one of the reasons he's honored is he was there at our first walking gallery gathering in Washington, D.C. He'd reached out to me, and I was like, yes, come visit me. We're going to have this amazing gallery show. We're going to have all these people. They're going to dress. Please come to the event. And he came, and he took pictures, and he was just so excited to be there. And he got to come back a couple other times. I took him to health events. But he lives in Dallas, Texas. And he had worked in computers and technology, right? And then he transitioned out of that job and was working on this idea he had for a new kind of business, as being an entrepreneur. And being an entrepreneur, he had no insurance. Yeah. Because a lot of people who are entrepreneurs have no insurance. Yep. So he started getting sick and went to the hospital. It turned out he had lymphoma, and it was at stage 4. So he, up until the week he died, they were still coming in his room asking for money. Yep. And the parents were trying to say, stay away from our son, he's dying. And so that's, yep. Unfortunately, how he ended his life hospitalized and unhappy and being badgered about insurance. Yeah. Right? So when we look at all this pain, we have to think of ways to make it better. Now, you know why I started this, because my husband died. Isaac's dad died. And he went through that kind of pain. We've got to stop it. It does not have to be this way. And I know if we all work together, if we activate everybody we know. If we fight for this, we will change it. We will change it in our lifetime.
Most people know me for that hashtag, HCLDR. It is a Twitter community that we have built. It's been running for just about 6 years now. We are one of the few remaining Twitter chats that still happen on a weekly basis. Most of the others have, folded their doors, and they were really great, and I started on some of them, but we seem to be one of the last few standing that aren't disease-based. And so what we do is every Tuesday night for the last 6 years at 8:30 p.m. Eastern Time, a whole bunch of people from around the world gathered, and we just talk about healthcare on Twitter using that hashtag.
I was one of the first ABO incompatible transplants in the United States. I don't know if you know what that means, but ABO meaning the blood types, right? They could not cross the blood barrier, so I am the recessive in my family. And I have the blonde hair, the blue eyes. My mom has blonde hair, that's recessive, the blue eyes. So I am type O. My entire family is A. So they cannot cross the blood barrier in living donation. At least they could not. Now they can. So you can take someone who is A-type blood and give that organ to somebody who has O-type blood. You can also do positive cross matches with genes these days.
People of different cultures and different belief systems involved and uniting in a space that they had in the penitentiary called Smith Hall, which was used ultimately for counseling sessions. Well, I ended up turning that place into a place where today, 2014 when I left, to this day, those programs are still enacted. Entrepreneurial programs, art classes, public speaking. What I had learned in prison is that many of the men in there didn't know how to read or write, and they were too afraid to go to anybody to ask them. But they felt comfortable enough to come to me and ask me to read the letters from their families to them. And I took great joy in that, and I did not make them feel any less than, but more than. I helped them with writing letters and sharing just insight with them and trying to make them feel whole. And in doing that, it made me feel complete.
So what we're talking about here is Blue Button and how we're really trying to create a data ecosystem that's going to benefit you and us as patients, as Medicare beneficiaries, as citizens even. And so what I'll do, let's have a little history lesson. Really, this chart should have gone back further, instead of to 2010 to actually like 1996, because back in 1996 we have good old HIPAA, which everybody talks about privacy, but the P is actually portability, right?
Medicaid rule number 2. We do not recommend that any Medicaid time be used for transportation. Liability. You put grandma in your car and you run into a stop sign, you run through one, or somebody hits you, who's going to pay for that? Well, Your insurance isn't going to, because your insurance will find out very quickly you were using your passenger vehicle for work, and you probably don't insure it as a transportation provider. So what is this caregiver going to do? She just walked into this house, and this elderly couple has been drinking water for 2 days. So I said, well, first of all, call the nurse, get an assessment done immediately. Get the nurse out there right now.
And it was back in about 2015 is when the message started getting out to parks that the Park Service was interested in doing this thing called Healthy Parks, Healthy People. It was something initiated, I think, originally with the National Park Service, although I don't know very much detail on when they started and where they are now with their program. But the idea being that these parks are beautiful green spaces and they offer so much opportunity for health, both mental health, spiritual health, physical health, and just being in the outdoors. We're learning more and more through science and through word of mouth how beneficial being in the outdoors is to your health and fitness and well-being.
When my job ended and I began working in a nursing home, every perception that I had about the United States and the healthcare system here immediately changed. And on my first night on the floor as a nursing assistant in a nursing home, I was given an assignment of 20 patients. I was one of 2 of the nursing assistants on that floor, and there was only 1 nurse present on that floor. On that night, I witnessed abuse, negligence, and poor decision-making from the administrative team.
So she doesn't have her own patient story, but she helps lots of patients. So her work is to work with children who are sad or depressed or anxious, and she helps them feel better. And she works every day, 5 days a week, with me.
The blue coat that was on the trike.
I remember when I went to MedX to speak on a panel session, standing outside and seeing the big sign that said Stanford University, and I just thought to myself, how did I get here? What I didn't understand. It's so weird. And I do attribute it, a lot of this, to Regina. You know, if Regina hadn't brought me to Cinderblocks, if she wouldn't have asked me to share my story, all of these other people wouldn't have heard it, and I wouldn't have had the opportunities that I've had over the past year.
I was actually told in a job interview that they thought their job was not a priority for them. No, I would be too busy in doctor's appointments to give them 100% of my time. Which is true. I do enjoy breathing air and walking on dirt, not being buried under it. So they're right, but I don't think it's a really good reason to keep me out of a job. I do what I have to do. You know, if not for the love of a good woman and a good support group like here at Cinderblocks, I would not make it.
Hear my voice this time, this is my fight song. Take back my life song. Prove I'm alright song. My power's turned on, starting right now. I'll be strong. I'll play my fight song. And I don't really care if nobody else believes, 'cause I've still got a lot of fight left in me. Losing friends and I'm
What did the cashier say to the cashew? I'm gonna cash you in. I have another one like that. Want to hear a joke about a broken pencil?
Sure.
Never mind, it's pointless.